They are only baby teeth. Why fix them? They are going to fall out anyway. Why bother? Why waste the money on them? Let them rot. Who cares? Hi, my name is Dr. Vacherie Peterson of 123 Brush Dental, Maplewood, Minnesota. I have been treating children for almost 40 years. Those statements, I have heard them so many times and they sadden my heart to no end. I'm going to tell you why. Precious little teeth should fall out naturally when they are ready, and they should fall out as happily and as healthy as they can. Please do not let baby teeth rot. You do not waste your money or your time when you spend them on your children's teeth. In fact, let me tell you how tooth decay can cause severe health problems and perhaps even lead to a child's death. This child had many cavities in his back molar, which are for chewing. He finds it painful to bite down on a lot of healthy food and only wants to eat soft food. Because of this, he is not getting the protein and nutrition needed to grow and do well in school. This child has cavities in the front of her mouth. She is very embarrassed and doesn't want to smile or talk much. This keeps her from making new friends and speaking up in class. The most tragic example is a 12-year-old boy named Demonte Driver. He died from a brain abscess caused by untreated tooth decay infection. There were huge newspaper headlines all across America when this happened. Such a sad story, and it all started from cavities in a tooth. I am making this video to explain to parents, grandparents, aunts, uncles, and other caregivers that helping a child keep all of those baby teeth healthy and beautiful is the right thing you should strive to do. I emphasize this a lot because of an experience I so vividly remember in my mind. A 19-year-old single mother brought her 4-year-old child to see me. Her front teeth had severe cavities. After explaining why those cavities needed to be fixed, the mother told me to pull out all of those teeth. Her own dad, who is the grandfather of the child, told her before she left the house to tell the dentist to pull any teeth with cavities. They will fall out anyway. Why fix them? Why waste the money on them? And why waste the time on them? I explained to the mother that sugar, candies, and the pop are the worst enemies of children's teeth and also adults' teeth. However, it was not too late to fix her daughter's teeth and keep them in her mouth until her permanent teeth were ready to come in. Mom agreed with me. Actually, the grandmother was there also agreed with me. The child was crying while I started treating her. After the injection, the child calmed down. Mom was sitting by the child and massaging her hands and feet. Then the child went to sleep while I was working on her. I didn't realize that the mother was calling home on her cell phone with the speaker on. She said, "Dad, the doctor said the candies and pop you gave your granddaughter rotten her teeth. Now the doctor is fixing them." And her father replied, "Why? I told you not to get them fixed. They are only baby teeth. Don't listen to the doctor. She doesn't know what she is doing." I started smiling without realizing I was joining in on the conversation. I said, "Grandfather, I went to school for 20 years, all the way through the dental school. So I really should know what I'm doing." You know what? He hung up right away. Okay, let's go back to our topic. They are baby teeth. They are so important. Here are the reasons why we should take care of them. Number one, baby teeth help the child stay healthy. The front teeth help bite food. The back teeth help chew food. Healthy teeth enable the child to eat. Therefore, they help children to have overall good health throughout the body. Number two, baby teeth keep the space for the permanent teeth. Otherwise, the permanent teeth may grow crooked, as I am showing you here. Number three, baby teeth make face look beautiful and healthy. They keep the aesthetic of a pleasant face for the child. Without teeth, the child could have low self-esteem and not want to smile. Number four, baby teeth allow the child to speak normally. When a child is missing teeth on one side of the face, the midline can shift the face and the face may look a little bit distorted. Number six, baby teeth help proper development of the jaw, the facial bone, and the muscle. Now, let's take a look at what happens if your child has cavities, also known as tooth decay. Number one, the bacteria that causes tooth decay are infectious. If one tooth has cavities, the bacteria can multiply and spread to the next one. In fact, if a parent has tooth decay and kisses the child, the bacteria will, from the parent's mouth, can spread to the child's mouth and cause new tooth decay. Number two, children often have difficulty communicating health problems. Children with tooth decay who are really young suffer pain in silence because they can't tell you where it hurts. They just know it's painful. Even older children sometimes can't tell you where it hurts, especially if you are immigrant children who can't speak English that well. Number 3, tooth decay causes toothache, leads to poor general health. Children can't perform well at school. Tooth decay is the number 1 reason kids are absent from school. Number 4, severe tooth decay can cause abscess, infection with pus in the gum around the tooth. An abscessed baby tooth can cause the permanent tooth developing underneath to be malformed. When the permanent tooth actually comes in the mouth, sometimes the enamel is defective and the color is brown or black. Number 5, severe tooth decay can cause abscess that travels. If your child has an abscessed tooth that is left untreated, the abscess can go to the brain and kill your child. This is what happened to Demante Driver, the little boy we mentioned earlier. Before we end this session, I will share with you the saddest case that I have ever treated. Several years ago, a 2.5-year-old child was brought by her family to see me. Imagine this, every single tooth in her mouth was rotten to the pulp. Some teeth only had root stubs left. Because all these teeth were beyond saving, we had to pull every tooth in her mouth until her permanent teeth grow in slowly and over a span of many years. She would not have teeth to help her eat, talk, smile, laugh, strengthen her mouth muscles and bone, and guide the permanent teeth into the right places. Please help prevent this from happening to your child or to any child in the world. Remember, sugar in the food is a terrible enemy to baby's teeth and the permanent teeth. Candy and pop are the worst. Even breast milk has some sugar and can cause cavities. So please, 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 as soon as your children's teeth grow in, brush them twice a day, morning and in the evening, every day. The most important time to brush is after the last meal of the day. In addition, bring your children to the dentist every 6 months. If there are small problems, the dentist can catch them in the early stages. Trust the dentist to advise you on the best treatment. I would like to end this video by emphasizing that your children's baby teeth are precious. Please take good care of them. See you in the next video. Bye-bye. Please subscribe our channel and like the video to help us keep making a video like this for you. Thank you.